September is Baby Safety Month. The idea is to increase awareness about safety issues involving baby products and to help consumers choose the right ones. Look, it's basically some parenting tips, and with a never-ending supply of new parents, it's never going to go out of fashion. So joining us now to help, Marisa Auclair. She's a postpartum registered nurse with Hartford Hospital. A pleasure to meet you.
Nice to meet you as well.
Thanks for being
having
on.
me.
Yeah, no, glad to have you. And there's a lot to talk to. First of all, the state legislature just recently passed a bill regarding safe sleep. And
Correct.
I think maybe for new parents are thinking, well, what is there to it?
Right. Yeah, and there's a number of things that are involved regarding safe sleep. It's something we really talk about at the hospital a lot. With the incidence of sudden infant death syndrome going down over the last 10 years, we really talk a lot about things that we can do to reduce our risk. Things like always putting your baby on their back to sleep, safe sleeping, having room sharing versus bed sharing with your babies, so that you can hear them, but that they are close enough to you and not in your bed.
Oh, so you don't roll over onto them. Okay,
exactly. And those things alone can reduce our risk by more than 50%. 1 in 12 kids, or 12 kids over the state of Connecticut die of SIDS every year. So it's important that we're raising awareness. It's something that kind of weighs on the mind of new parents.
Yeah, tell me if I'm wrong. I used to think that it was a lot more mysterious than that 15, 20 years ago. They didn't know what was causing it. This is implying that it's all, maybe not all human controlled, but a lot of it is.
Yeah, it is. And we found a number of things that we can do that has really reduced our risk. Like I said, back to sleep, swaddling infants, keeping the crib to a minimum. So it should be a firm mattress with nothing extra on top of it, a swaddled baby with no extras in the crib. So there should be no crib bumpers, no stuffed animals, no pillows, and no extra blankets.
Might be counterintuitive. You might think, oh, I want my baby to be comfy and cozy, but a lot of that can work against you.
Yeah, so there's safe things that you can do as far as like the Halo sleep sack, or there's swaddle blankets that will supply them with a blanket in a safe way.
All right. What are some of the other safety hazards we've got to look out for?
Car seat safety is a really big issue, ongoing through everything here. About 1 in 5 car seats is installed unsafely. There's a number of fitting stations throughout the state. You can actually head over to ctsafekids.org. There's about 75 fitting stations all over our state, or you can call your local police department. There is a safety inspector there that can assist you there. As far as the Connecticut state law for car seats, infants under the age of 12 months are required to be rear facing. They have to hit 12 months and 20 pounds in order to turn to a forward facing car seat.
12 months and. It's not an or.
It's not an or, correct. Yep, in which case they would be in a convertible car seat, which is a 5-point restraint harness, and they would stay in this until they reach the height and weight limitations of that car seat. And then they would move to a high back booster. The high back booster seat they would stay in until they reach 7 years old and 60 pounds. Okay,
so 7 years old, yeah. So just say it again. You can never repeat it enough for people.
Right, exactly.
You mentioned 1 out of the 5 are installed incorrectly. Are you seeing some more common mistakes than others? I mean, I know when I'm trying to do it, there's a little maze in the top you have to put them in.
Yeah, I think that every car is a little bit different. Some have that you can just use the seatbelt that has a locking mechanism. Others have a 2-point on either side of it. So it depends on the type of car, and this is where the car seat safety inspector really comes into play. You want to make sure that car seat base is installed properly, so that way you're driving safely with your children in the car.
I know sometimes with those in the booster seats, there's a little sort of armrests coming out. I mean, does the seat have to be above that, or the belt above it or below it? Does it matter in that case?
I think it varies car seat to car seat. They usually go behind the car seat a little bit, behind the padding on the back, so they're all a little bit different in that respect.
I'm just using you for free advice at this point. Well, thank you so much for your time.
Thank you for having me.
Yes, thank you so much. And once again, there's fitting stations around the state, so you don't have to try to soak this all in yourself. You can get it right there. Thank you so much. There's so much we didn't even get to, but every little bit you told us is precious.
Beautiful. Thanks.
Thank you.